Of all the movements I ask people to do, cervical or neck retraction is one of the most challenging for patients to do correctly. It's a movement they hardly ever or never do. And I think that's part of the reason why it can be so therapeutic for so many patients who have a diagnosis of a mechanical problem in their neck. Because it's challenging, I try to come up with ways of explaining it for patients so that they do it correctly. One example is to ask the patient to create a double chin or a triple chin. Another analogy or way to think about it is if a patient can visualize someone coming to punch them, kind of how they bring their neck back like that, or if someone's coming toward them with bad breath. I don't use the word chin tuck because it kind of implies to some people that they need to go down, tuck down. I use the word retraction. For some patients, they call it the turtle maneuver, so we'll call it the turtleneck or something like that. But I'll demonstrate with patients how I do it. I'll usually use some guidance with my hands so they can feel the movement and how it's a gliding back parallel to the floor. I'll typically show them from the side view of my neck what it's doing, how we're taking away the curve of the neck that's natural and flattening it out. And of course, I can take pictures or videos for them to reference when they get home. Making sure they do it correctly is of course imperative because we're assessing in many cases what happens when we add cervical retraction to your life on a regular basis. Typically when we're testing, I'll have patients do at least 5 to 10 every few hours. And when it becomes the treatment, it's also the same kind of high frequency for a while until we can taper away from it. Most times people graduate to needing overpressure with their hand to get to full end range. Most joints need some overpressure to get that final end range and be extremely therapeutic. For that, I have people either apply pressure with their fingertips, or they can use the web space of their hand, or they can use their knuckles. I don't really care as long as when they do apply the overpressure, they're staying in that plane parallel to the floor and using the overpressure to produce a little strain or pain at the end range so that we know we're getting the joint as far as it can go.